Good morning, good morning, good morning, Village. How are you guys doing out there? It's great to hear from you guys. Great to see you. Great to be in front of you again. You are here. This is the Black Mental Health Channel. And so I'm glad you're here. Let's go ahead and jump into another conversation. Let's check in, just make sure you guys are doing okay. Again, this is the Black Mental Health Channel, where we talk about all things mental health, all things related to emotional well-being and relationships and choices and decisions and emotional functioning as it relates to Black people, African Americans, all people actually in general, just trying to help out the community, the family. And so this is a place where we have hard conversations. My name is Harold Rayfield. I am a licensed professional counselor and therapist here in Oklahoma City. I'm the clinical director here at Spring Eternal Behavioral Health. I'm also a life coach, licensed in the states of Oklahoma, Texas, Georgia. I'm all over the place trying to spread the good word, trying to be a talking point, talking head about these conversations that are so important to all of us, myself included. So let's get right into it, right? So hopefully you guys are doing well. You guys are doing good out there. We are now turning the corner to the end of the year. October is winding down. We're about to celebrate Fall Festival this weekend and all kind of activities and holidays. And so I just wanted to take time to highlight this month. As you know, October is National Awareness for OCD, right? It's also the National Awareness Month for Depression. And so I thought for today's conversation, for today's moment, we just talk just a little bit about depression because it's such a huge part of mental health, and it is a growing challenge for our community. Recently, U.S. News last month, probably about September, the last week of September, published an article that said that depression is growing at a rapid pace here in the United States. According to the U.S. News and a study, back from 2015 to 2020, during a 5-year period, depression was increasing, right, but was at about a rate of 9% of the population. Right now, depression is roughly about 10% of the population. So 1 out of 10 Americans are going to be suffering from the mood disorder from some form, some level of depression, right? And so we know what depression is. Depression is about elevated or increased or high levels of sadness, loneliness, changes in mood, right? In a negative manner, a negative outlook. There are several symptoms of depression that you need to be aware of. I need to be aware of. We need to look out for, right? We look out for ourselves and for other people, right? So whether it's changes or in our appetite or our eating habits, right? A decrease in the desire or willingness to eat. Another symptom of depression might be isolation, where you start to pull yourself back, or you see someone starting to separate themselves, segment themselves from typical activities or typical people they would be around or things they would like to do. Another symptom of depression are low energy levels, low sense of motivation, low sense of worthiness, low sense of purpose. Anytime you hear statements or you start to feel some sense of wanting to not do the things that you normally do, those could be signs of some form or fashion of depression. So we got to be aware of that. So whether it's eating habits, whether it's engagement levels with people, whether it's your energy level, also poor concentration, right? Inability to stay focused and on task, low productivity at work, um, poor sleeping habits, right? If a person is struggling with being able to get enough sleep or staying asleep or not being able to go to sleep, those are all symptoms and signs that maybe you might be experiencing a depressive episode. So those are the symptoms of depression. We talked about some of the basic numbers behind it. It's increasing, it's growing. Why? Why is depression such a big thing now here in the United States? There are a lot of reasons why, a lot of sociological reasons why depression is such a huge problem. But I would argue that right now, just like every year prior that life is hard, man. Life is hard. Adulting is really, really difficult, right? So life is not as simple as go to college, get a job, or finish high school, start a career, open a business, right? There are a lot of factors. Financial issues seem to be a really big part of some depressive symptoms, right? People just can't get ahead, turn the corner financially, get into a place where they're happy, where they're content with where they're at. Family issues, whether it's past family issues or present family or relationship issues, those are huge contributors to depression. Uh, what else? I mean, there's just so many different aspects of depression on why it's so prevalent now, right? You can also look at other public health issues such as the pandemic, right? COVID. Um, those things are huge contributors to depression, right? We started one way where the United States seemed to be doing really, really well after we had this financial crisis back in 2010-ish with the cars and financial system and real estate and all that. So we were really in a really difficult, tough place financially, economically in the United States. And therefore, we had a nice run of like where we were getting back on track and things were going well. And all of a sudden, man, bam, the pandemic comes out and it really takes a toll on us in all different kinds of ways, right? Where we as a community, as a nation, were isolated from one another, right? People were dying, we lost loved ones, and so all of those can be contributors. There we go, contributors to sadness and depression and isolation and all the things we just talked about as far as those symptoms. And so like big life changes, big life transitions also contribute to depression, whether it be a loss of a job, loss of a family member, whether it's your kids leaving the house, they're, because they've moved away because now you're an empty nester, now you're alone, maybe loss of a relationship, lack of companionship. There are a lot of factors that go into it. So there's no one thing that can cause depression. However, one thing can be the catalyst that starts it. So that's why we got to be more aware. We got to be more self-aware and constantly checking in with ourselves, right? There are times when you could be working and going through life and doing what you do and trying to pay bills and trying to take care of folks and take care of your kids and check in on family. And then next thing you know, you can slip into a place or you could slide into a place where you just feel disconnected, just not engaged, not happy, not content, not fulfilled. And so it's easy for us as individuals, even me as a therapist or a mental health provider, where I can go through moments or periods where, man, I'm just not myself. I feel down. I feel discontent, disconnected. And so it's always important to be self-aware and to constantly be checking in with yourself to make sure that you're doing okay, right? So how do we fix it? How do we uh, apply some knowledge or some solutions to dealing with depression? It's a bigger issue, bigger challenge, but just a few things. Obviously, it's just being more self-aware, checking in with yourself, right? That's the first place you want to start, is just to making sure you're keeping track of yourself emotionally so that you're still in a good, positive, healthy place. It's also good to check in with family and friends. It's also good to check in with yourself. You got to also make sure that you're taking care of yourself. Self-care is super, super important. I know what you're gonna say, Harold, man, I got no money for self-care. I don't have any time, right? Adults, I don't have any time for self-care. I got people that are looking up to me, people that need me. I got children or people that are counting on me. Work and responsibilities are heavy on me. And so I understand, I get it, but you just got to remind yourself that you're the most important, right? You're the most important piece of your life. And so it's going to be okay for you to say no sometimes, right? Another strategy for making sure that we are monitoring ourselves and making sure we are being aware of how we feel is having healthy boundaries with people. It's going to be okay to say no. You can't do everything. You can't save everybody. You can't fix every situation without first taking care of yourself. It's okay to say no, right? It's okay to say no. You got to be self-aware. You got to check in with yourself, right? Another thing, you got to monitor all of your activities, right? Take time for yourself. You got to love on yourself. Always, always, always Try to find time, try to step away, to have quiet, have peace. Another strategy for fending off depression, making sure your mental health is in a positive place is we also have to be content and positive. And sometimes you have to disconnect from other people. You have to monitor what your spirit, what your mind, what your heart is receiving. So if that means that you need to take time away from social media, feel free to do that. If you need to take time from the news, feel free to do that and do other things, right? There are so many other things outside of scrolling on social media that we can do when we're not at work, when we're not with our kids, right? And not feel guilt about it, right? So a big part of it is that when you take time for yourself, to care for yourself, to be self-aware, to monitor your emotional well-being, that's not a selfish act. We got to remind ourselves that that's not a selfish thing. It's a positive thing, right? You're taking care of yourself so that you can be available for yourself. You can show up for yourself and also show up for the people that you love and care about. So that's important. So a few things you can do. Make sure you are out and engaged, right? If you are feeling like you're getting disconnected, or if you see someone, a friend or family member, starting to pull away, encourage them, help them, support them to be engaged, right? Instead of disconnecting, re-engage, reconnect with the things that you're passionate about, that you love, that you value, right? That are important to you, that give you purpose and worthiness, right? So engage, be active, right? You always want to do the opposite of what your feelings are telling you. Depression is telling you to pull back, be isolated, be alone. You need to do the opposite. You got to speak positive. You got to think positive. Surround yourself with positive people, right? Very many times, right? Sometimes we are connected to people who are only feeding us negative energy, negative vibes, drama. It's going to be okay to say, you know what? I think I'm going to take a break from this relationship, to reevaluate, to see if this relationship is even worth continuing. So sometimes it requires change of relationship, change of environment. Sometimes we got to change our work situation to where, hey, yeah, maybe you need to walk away from some things or some people or some situations so that you can find things that truly you love, truly important. And there's no value or price tag on peace. There's no value or price tag on peace. And so I just want to encourage you guys today, just be positive that, you know what, we have made it through. We're close to making it through 2022. There are always going to be better days ahead. There's no one thing or one problem or one situation that can defeat you. You just have to be encouraged and stay positive. The next day will always be a little bit better than the last. And so we're all going through it together. We're all working on things. And so be mindful of how you feel. Check in on one person every single day that you know, you love, you care about. Just check in, because you never know when that's the day when they need to hear something positive from you. So that's all I got for today. October is National Awareness Month for Depression. I'm going to leave a depression screening, and the link is free. It's not mine. It's got it online. And so I'm going to leave that. Feel free to take that, send that to a family member, check in with them. Right, check in with them. We know it's been a long year. We've been all working hard, trying to make it and make the best of the situation. So that's all I got for today, Village. I love you guys. Hopefully, you guys are doing well. I know we're going to make it, and there are better days ahead. Just be positive. Love on the people that are around you. Love on yourself. Be kind to yourself. Give yourself grace. Until next time, we'll talk to you guys soon. Peace.